4, 3, 2, roll tape. Cumberland Matters.
Hello and welcome to Cumberland Matters, a show designed to inform you about issues, services, and upcoming events involving various departments of Cumberland County government. I'm Sally Shutt, and this month we will look at the H1N1 Flu, a storytelling festival at the library, and our soil and water conservation service. Stay with us to learn about a new transportation program for rural residents and fire prevention tips to keep you and your family safe. The Cumberland County Health Department has been diligently working along with various community partners to inform our citizens about the H1N1 flu. Dr. Lan Tran Phu is the medical director of the Health Department, and she explains the symptoms to look for and things we can do to prevent spreading the illness.
The swine flu is, we don't call them swine flu anymore. It's the flu that is caused by the newest strain of the H1N1, and it used to be called the novel H1N1 flu because this is a new strain that we are not previously been exposed to. The symptoms of the H1N1 flu are exactly like those of the seasonal flu, meaning we have fever, sore throat, cough, runny nose or stuffy nose, body ache, headache. Some people will have vomiting and diarrhea, and some people will not even have fever. The H1N1 flu, like the seasonal flu, they are transmitted by droplets, like people when they cough or when they sneeze. The droplets will be spreading from one person to the other when they are close enough, meaning within 6 feet. To treat the H1N1, we have the antiviral medication that will help shorten the duration of the illness. So instead of lasting a whole week, for instance, it will last only 5 days. But for all kinds of flu, we are focusing more on preventing the flu instead of treating the flu. The people who are at higher risk to catch the H1N1 is the pregnant women, children between 6 months of age to 24 years of age, and all the adults when they have a secondary chronic illness such as asthma, diabetes, immunodepressive disorders such as HIV, cancer, and also children, infants less than 6 months of age, they are also at high risk also. So we are targeting the people who care for those infants. The seasonal flu vaccine is already available, and I will strongly recommend everyone, especially the people who are more than 65 years of age with underlying chronic illnesses, to get the seasonal flu vaccine, which is already available. According to the CDC, the H1N1 vaccine is as safe as the seasonal flu vaccine, especially the shot, which is the non-live virus. The H1N1 vaccine will be provided free to us from the CDC. However, there will be an administrative fees that the CDC will decide for us to cover for the cost that all the agencies incur when we provide the vaccines to the public. Our strongest message is to prevent. So like for the flu, all kinds of flu, seasonal as well as H1N1 flu, we have to prevent, protect ourselves from spreading it and from catching it from others. So whenever we cough, we have to protect our cough so that we don't spread it around to others. When we use Kleenex, we have to dispose of the Kleenex right away, and we have to wash our hands. very frequently and sufficiently long enough to make sure that we get rid of all the germs. And then if we have the symptoms, we have to have the discipline to isolate ourselves from the public by staying home, and then make sure that we are well hydrated, we drink and we rest, and to protect the community. If you have the symptoms, we advise you to stay home and not to go to school or not to go to work until you are fever-free for 24 hours without taking any medication to reduce your fever. That is the latest recommendation from the CDC. And the fever-reducing medications are like the ibuprofen or the acetaminophen. The brand names are Tylenol or Motrin Advil, because whenever you are still having the fever, it means that you are still contagious. So the message is for people to stay home when they still have fever, and we advise everyone to keep themselves very well hydrated, because when you have fever, we have a tendency to be dehydrated.